Well, at Great Lakes, we're particularly proud of a couple of our programs, and one is our FASD Training of Trainers Clinical Certificate Program, and that's an intensive 30-hour training program where folks spend the entire week with us. We teach them all the competencies regarding fetal alcohol syndrome, preventing it, treating it, identifying it. We've trained about 125 people in this intensive 30-hour course, and about 75% have completed and earned their certificate in FASD education. Each program has maxed out and we've had a waiting list, so it's in pretty high demand right now. Just increasing the skills so your average family practitioner, your average internist is able to make this diagnosis, pediatrician especially, is able to make this diagnosis on their own.
There's a FASD curriculum that's probably this big and full of everything that people need to know about the FASDs. And what's happened with that then are these regional training centers like ours have taken that huge curriculum developed by national experts and have broken that down into different types of training. So we've put ours into academic courses. Other regional training centers have put theirs into lunch and learns for physicians or nurses.
The Arctic RTC is important because Alaska is a very vast region that has a lot of unique issues given the proximity to the other 49 states, and as well as the weather and the geographic region and the cultural needs. So it is helpful to have a regional training center in the Arctic area in order to provide the resources.
Our center, has trained 5,200 trainees in the past 3 years. There is a lot of focus also now by our centers to do screening and brief intervention of alcohol intake and other drugs, and not only in the childbearing age. It's kind of treated as a universal problem like smoking. It should be like weighing you or taking your blood pressure. It is as important as that.
This is a wonderful project that's been funded through the CDC, and it's one that we have found to be very beneficial. We've been training folks across the state and in multiple disciplines, because we have physicians, we have psychologists, we have social workers, we have nurses, and to start to see how they kind of have that new awareness that kind of sets in. I think it's been very kind of rewarding for me, but I think it's also really increased the knowledge base across the state for the number of folks that have now been trained in fetal alcohol issues.
One of the things that I focused on with the Southeastern Training Center is addressing correctional populations, especially health providers who work with people in juvenile justice or jails and prisons. If we were more aware of the brain injuries that cause aberrant behaviors or unlawful behaviors, I don't think we would want to see those people in the courtroom, and we'd be more open to diverting them to more supportive resources.
The way I see the purpose of the regional training centers is that this is a very large country, and each of these regions have unique characteristics. We can tailor our education, our trainings specifically to match those targeted populations that we work with. So I think it's a good model.
It is helpful for us when we're working with providers to really sell our topics because we are supported by the Centers for Disease Control. It's helpful for faculty too to understand the importance of this issue because we are funded by the CDC.
What was most striking to me, and is kind of this is why we're here moments, is as soon as they get the diagnosis, the complete relaxation and the, I'm not stupid, so I'm not stupid, it's not me. And really for the first time understanding that the challenges they faced in their life really wasn't them not trying hard enough, them not getting it, them being, their own words of feeling stupid, as much as not understanding. Us as a field not recognizing it until they were in their 30s, 40s, or 50s even.
An example I always like to give is like you can smoke 2 packs a day for 30 years. You may get cancer, you may not. But do you know if you're going to get cancer? Your chances are going to be much more, but not everybody gets cancer. So it's the same thing. Who knows if it's 1 drink or 2 drinks or 3 drinks? Some may get it, some may not. Are you willing to treat this as a Russian roulette and with the baby? I'm not.